Hi friends, this is Dr. Sujata Naik in the series Lesser Used Gems of Materia Medica. Today's remedy is Carbo Animalis or animal charcoal. Along with carbo veg and graphitis, it is one of the three carbons proved by Dr. Samuel Hahnemann. An extremely deep acting polycrest, it is wonderful when indicated and acts and hits the bull's eye more often than not. Carbo Animalis' chief action is on the venous system and the glands. In venous system, it causes plethora, varicosities, it causes extreme feebleness of the circulation, especially indicated in the elderly who suffer from varicose veins, varicose ulcers, hemorrhoids, poor circulation of the lower limbs with easy spraining of the ankles. A patient is extremely debilitated and debilitated following some discharge which is always exhausting. So whether it is a leukorrhea, whether it's menstrual discharge, a diarrhea or even coryza, any discharge makes the Carbo Animalis patient extremely weak. This is also very similar to what carbo veg constitution is like, because they also suffer from ailments which follow loss of animal fluids. However, the major difference between Carbo Animalis and carbo veg is that carbo veg also is as chilly as Carbo Animalis. Carbo Animalis, the ailments are from dry, cold air. They are always better in warm, moist weather. They want the windows to be open, unlike carbo veg, which want to be in a closed surrounding with warmth around them. However, the carbo veg patients wants to be fanned because of low vitality and low oxygenation. The Carbo Animalis patient has no desire to be fanned. He just wants the room to be well ventilated. This is the major difference between Carbo Animalis and carbo veg. As we mentioned, it is the old age remedy. So one of its chief indication is sensorineural hearing loss in the elderly. So when there is hearing impairment in the old people who shun any kind of social contact, are averse to meeting people, company, averse to crowds, mixing with a group of people because of the hardness of hearing, they cannot make out which side the sound is coming from and get confused when several people are talking together. That's where you can think of Carbo Animalis, which may restore their hearing to some extent and their confidence as well. Another indication for Carbo Animalis is the induration, because it has its action on the glands. So swollen, hard and indurated glands is the hallmark of Carbo Animalis. As the disease progresses from functional to structural and from tubercular to psychotic to syphilitic, you'll see more indication of Carbo Animalis coming in. You'll see more cases of Carbo Animalis being indicated. So it is also, in recent times, we found it very useful for post-COVID complications. Never well since pneumonia, never well since bronchitis, never well since typhoid. These are important modalities for important ailments for Carbo Animalis. Especially pneumonia, which COVID pneumonias following after that, when patients suffer from complications related to that, especially coughs or colds which don't seem to go away, or a debility which continues in spite of everything being taken care of. Carbo Animalis could be one of the indicated remedies. So therefore, because of its deep action, because of the miasmatic influence, because of its chronicity, it is often indicated in cataracts, hemorrhoids, varicose veins, varicose ulcers, diabetic carbuncles. It is indicated for low back pain in most of the elderly patients. So we had this patient, around a 55-year-old man, who approached us for a cough which wasn't subsiding even after his COVID got resolved. This was 6 months following his COVID. He had COVID pneumonia, for which he was put on antibiotics and steroids and remdesivir. He did recover, but the cough kept lingering and was bothering him. As he entered our clinic, we saw that he was wearing a thick jacket. He was extremely chilly. He was not comfortable in the air-conditioned environment of the room, though it was at an optimum temperature. He had a bout of cough in front of us, and the cough resulted in breathlessness. Following the bout, there was one symptom which was very characteristic that he mentioned. And he said that, "Doctor, is there some way you can open a window here?" There were no windows in the room. Because I'm feeling very suffocated because there doesn't seem to be ventilation here. So as he was taken out to another room which had windows, he seemed much more comfortable. So whenever you see a patient who is old, feeble, weak, has varicosities, varicose veins, has easy spraining of the ankles, perhaps has hardness of hearing, or has had a history of pneumonia or bronchitis, and the debility is so marked that the patient is unable to sit for very long because of the weakness and generally following some exhausting discharge, your remedy has to be Carbo Animalis. Thank you.